I'm going to talk to you in regional contexts of where are we in terms of HIV today. And as you see on the screen, we are at a crossroads, and Andre and other speakers have touched on a few elements of where are we at in terms of the epidemic for ourselves in our region. And I want to look at what your assumptions are about Eastern Europe and Central Asia and the epidemic. Is the epidemic as severe as some say? Some feel there may be steady improvements across key indicators. As more countries graduate in income status, they should need less support. But the data story that we will share and that the communities can speak to so strongly will challenge the assumptions that some have outside the region. And the conference in Munich was a great opportunity to share directly to the world lots about what is happening in the region and where the needs and the gaps are. Quite diverse countries, diverse epidemics, but today we shine a light on the countries that are being left behind, in particular, the communities that are being left behind, and the economic realities that can compound the losses and compromise the gains made so far. Next slide, please. The estimated number of people living with HIV in Eastern Europe and Central Asia in 2022 was 2.1 million people. 140,000 new infections and 44,000 AIDS-related deaths over the period in a report of the Global AIDS Report, the last 10 years. And you can see on this slide the difference between our region and other regions. The global average reduction in new infections is 38% in that period. But if we take Africa, Western and Central Europe out of the picture, what's left is a stagnating or deteriorating trend in regions across the world with HIV epidemics primarily affecting key populations. That includes Latin America, the Middle East, North Africa, and Asia and the Pacific, where we have a plateauing. We're not having the declines that we need across the region. We've got actually countries rising. And we're seeing that in a number of places around the world. But the most significant is our own region of Eastern Europe and Central Asia. It's the only region that has an increasing mortality, an increasing death rate. And it's the second fastest growing epidemic, but it is actually ahead of the Middle East and North Africa when we look at numbers. Next slide, please. The region falls short of the global averages for testing, for treatment coverage, and viral suppression. Worldwide, testing coverage stands at 86%, while our region is just 59%. While global treatment coverage in 2023 was 77%, in our region only half, less than 50% of people living with HIV were on treatment. And just 42% had achieved viral suppression, the lowest rate in the world. It says something about the quality of services that people are able to access, or challenges around maintaining access and engaging with the health systems. Next slide, please. In the region, there is moderate treatment coverage, as I said. Now, we also have a challenge in some parts of the region, very big epidemics, poor data sharing. And so it's hard to always present this across. So I'm sharing elements of what's happening across the region, but not all countries. There's moderate treatment coverage in most countries. Some countries like Moldova, Armenia, Kyrgyzstan were treating just a bit more than half of the people living with HIV. Some are increasing year by year, others it's a much slower pace. But there are also large numbers coming in with late-stage illness across the region, which explains the high death rates and also makes you pause and think, why are people coming in so late with their illness when they must have seen signs of it earlier? For example, between 2016 and 2022, late diagnosis rose by 24% in Kazakhstan and 34% in Armenia. Next slide, please. And this is the impact of those country-level challenges for us as a region as a whole. In Eastern Europe and Central Asia, new HIV infections have increased by 20% since 2010, and the region is critically off track in reaching the 2030 targets. Next slide, please. The HIV epidemic in Eastern Europe, Central Asia is concentrated among key populations. It has the highest concentration of any regions. 94% of new infections in 2022 were among key populations and their sexual partners. 1/3 of these infections were among clients of sex workers, and over 1/4 of new infections were among people who inject drugs. Next slide, please. PrEP, which we just heard from Andre, was a highlight of the Munich conference, has the potential to markedly lower new infections. But in EECA, we're nowhere near the pace of adoption that is required. Too many countries are stuck in pilot projects of very small scale and are not moving to national rollout. We will not see the expected payoff in the countries, let alone across the region, from investments in PrEP unless it's implemented at scale. The new technologies, lenacapavir, injectables, could be an answer to some of the challenges that's holding back the scale-up of PrEP. We have a mixed picture where some countries are accelerating the progress with PrEP, while others' PrEP rollout hasn't gained national traction or even is at challenge of stopping. There's a huge gap of more than 95% for EECA to reach the 2025 PrEP target. Barely over 20,000 people on PrEP in 2023. As I said, once the cost issues with lenacapavir are addressed, the availability, if it can be introduced into national programs, will have a great impact, both in the prevention, but also in the treatment opportunities. And when we need to deal with structural barrier issues, this is going to be significant as a way around this. Next slide, please. Because the restrictive legal environment in our region undermines the potential of societal enablers to support the response. The legal barriers, the stigma and discrimination are major obstacles preventing people from accessing prevention, from testing, and as we saw, from accessing treatment services or coming into treatment when there's little option and little hope of survival. In our region, 16 countries criminalise some aspect of sex work, 2 criminalise same-sex relations, 5 criminalise drug possession, and 13 criminalise HIV transmission, exposure or non-disclosure. And often, where in the case of same-sex relations is not criminalised, they'll use another law, like the risk of HIV transmission, to harass and to in a sense, be used as a way of criminalising or trying to punish people for same-sex relations or other activities that the country or the police feel is not acceptable. The intersectional issues between these are critical. We're also seeing pushback on gender rights, a whole range of issues across the spectrum. So this is where we can't just see HIV in isolation. We need to be looking at the intersection between issues that are happening on gender rights, the rights of women, gender-based violence programs. What are the intersections, these structural issues that are happening in our societies that need to be addressed so that we don't go in silo and address them all separately? Next slide, please. This slide shows select findings from the Stigma Index 2.0 reports and behavioural studies. The structural enablers, which should facilitate access, often act as the barriers due to restrictive policies. Nearly half of surveyed people who inject drugs in Kyrgyzstan and 32% of people living with HIV in Tajikistan reported avoiding medical care due to the stigma and discrimination. The fear of stigma and discrimination also deters people from seeking testing in the first place. For example, key populations across the region often avoid testing due to concerns about either confidentiality, legal repercussions where it may be used to criminalise their sexuality or other aspects of their lives, or potential exposure to discrimination within the healthcare settings themselves. In some cases, mandatory reporting requirements deter individuals from accessing the testing services to start their entry into support for prevention or entry into treatment, particularly those engaged in criminalised activities such as drug use or sex work. Violence remains a risk factor for HIV. A quarter of men who have sex with men in Kazakhstan reported experiencing physical and/or sexual violence in the last 12 months. Andre mentioned Georgia and Kyrgyzstan and the pushback, the increasing pushback on rights of people across different parts of our societies in the region, and the impacts particularly on people at risk of HIV or men who have sex with men, other parts of society. And it's not just those two countries. We're seeing this in other parts of the region like Belarus and others. U equals U. Zero transmission of HIV through sexual transmission is a missing link in a number of these areas, and we need to do more to encourage countries to expose the community to understand where are we at with HIV today. If people can access treatment, take their treatment, and achieve viral suppression, they don't pass HIV. But we're not seeing U equals U being used by countries to address the underlying stigma and discrimination that are stopping people from accessing the services in the first place. Next slide, please. The region's high donor dependency for prevention may become a looming crisis, and we're expecting serious concerns with the upcoming replenishment of the Global Fund, with what's happening in the geopolitics and new governments across the world. 8 of 12 reported countries in EECA relied on international sources for more than 50% of prevention financing based on recent data reported to UNAIDS. Strategically, we need to consider sustainable approaches, but how do we mobilize government investment in prevention while simultaneously advocating for continued donor support in the light of current funding challenges? Next slide, please. The inequalities are at the core of this story, across regions, across countries, within key populations, and across key populations. To address the disparities in healthcare, HIV services and funding, we must confront these inequities directly. And as I said, we have to look outside HIV and look at where are the other parts of societal issues, like gender issues that are being addressed with the same, are faced with the same challenges, and look for partnerships outside of the usual. Funding is always going to be a challenge, and increasingly a challenge for us, so we need to look at new strategic partnerships and opportunities to address these underlying issues and structural barriers. It goes beyond the service delivery. It's about the strategies to bridge the socioeconomic, the political and legal divides that leave our communities and in places our countries behind. Our region's varied economic outlooks also demand careful attention. Some countries risk losing the hard-won gains without continued investment, while others need dedicated donor support to address severe service gaps. If we see graduation from Global Fund very quickly in countries in our region, the concern is, will the countries pick up the funding gap that will remain to make sure that these programs and the responses are sustainable and continue to grow? Granular data is also essential for the informed decision-making. Some countries are not sharing their data. It's hard for us to understand the impact because of the close relationships between communities and the issue of migration between countries in the region. We need to strengthen that data collection and analysis so that we can create those regional or sub-regional strategies and strategies within individual countries that are evidence-based and tailored to their unique needs. There's a catalyst for innovation, and that's where the UN and other partners can come together with community and with government and research institutions, academics, to look at where we can spark initiatives and leverage the partnerships that can close those gaps, coordinate the responses, and engage non-traditional partners to deal with the multifaceted challenges that we deal with HIV. Some seem to try and narrow HIV down to purely a health issue, and anyone who's worked in the response to HIV in our region know it is very much more than that. Maintaining partnerships in a divided region. Despite political divisions, our commitment is to collaboration, and it remains strong. We will reinforce partnerships across boundaries to support a unified response. In this way, we can protect the past achievements and plan for a future where HIV may no longer be a primary focus, globally or regionally, and ensure resilience amid the shifting priorities. Therefore, we need to adapt to constant change with rapid and unpredictable shifts. We need resilient, flexible strategies. We need to modernise the HIV services and support sustainable roadmaps with communities and countries, governments working together on what is essential to retain and where to scale up action to have the impact on the epidemics. So these are just a few highlights for the consideration as you go forward in the discussions during the meeting. So thank you very much. And again, I wish I was there with you in person to discuss the very important issues being considered. Thank you.